Welcome to Electrolysis Unplugged, Mentorship Hour Rewind, brought to you by the Electrology Education Coalition. I'm Stephanie, and together with Joanie, we bring you real conversations, expert insights, and community learning from electrologists around the globe. Whether you're a student, a seasoned professional, or simply curious about permanent hair removal, these episodes are here to educate, inspire, and connect us through the pillars of education, research, and community.
All right. Hello, everyone. Welcome to this week's episode of Mentorship Hour.
Hello, hello. I know that we briefly discussed last week at the end doing the case studies. That's kind of, nobody really emailed in case studies.
I pulled some.
Joanie pulled some.
Okay, we can kind of jump into it. Just to wrap up a little bit of what we did last week, in case you weren't here or you forgot, we had gone a little bit into treatment planning. And so that's always the hot topic, right? I lectured about it this week at school. And so it's a hard thing to get a grasp of, and it's a hard thing to explain to clients. It's also in the Beyond Electrolysis textbook. So lots of nice graphics in there. If you haven't grabbed that book, then, you're missing out. But what I'll do is just a portion of that talk, just talking about some case studies. I don't have that many. Stay tuned for possible research committee stuff or more case study. But let's go ahead and share the few things that I do have.
And if you're interested in being part of the research committee, we're sending out emails with our first meeting here next month, like in the next couple of weeks. And then you guys can get to know what our goals are for research, because we're pretty excited about it.
So this is kind of how these things were set up. So I've had some clients, and the ones where I have some progress photos taken, we have some data. And so there's a couple assumptions. I pretty much used a rate of $100 an hour just to make it easy for the math. And then you've got a little bit of background on each of these clients. So I'll put down the situation on consultation day, and then we can just kind of discuss a little bit like what we think, how we would have approached this, why. And it's great if somebody's got a different way to go about it. Let's just talk about it. So case study number 1, we've got a 30-year-old cis female with hair on her chin. She shaves twice a day. Client sensitivity, availability, budget, and health were not an issue. Upon visual examination, we classified her as a hirsutism 3. Note here that hirsutism classifications to a certain degree can kind of be, dependent on the person and what they consider a 3 versus a 2. Some people say that it could be a 2. Some people say, that it's a 3, it's whatever. But whatever it is that you're using for your hirsutism scale, make sure that it matches across the board for your clients at the very least. She shaves, with her shaving every day, I assumed fairly aggressive hair growth. I scheduled about 2.5 hours for her first session, assuming that that's enough time to clear the entire area visible for that day. So why don't we just start with thoughts on this?
My initial thought is the background when it comes to the onset of this hair. Is this based primarily on them being hirsutism based on like medical background, or perceived hirsutism based on paradoxical hypertrichosis? Do we know?
So I asked if she had ever been, what her blood work, if she's done any kind of tests for PCOS, for example, or anything like that. And I believe that the medical tests, if I can recall, were inconclusive. So pretty much, and I think that's kind of, we'll talk a lot about this next month, or this month, actually. We're already in September. We'll talk a lot about this month with PCOS and what that means for people. But it's, a lot of women go to doctors, and unfortunately, they have a really hard time getting that diagnosis of PCOS.
But it's usually 5 to 7 doctors before it. Yeah. So when I look at this, this is kind of how Stephanie's brain works in heavy cases. She does not have enough density for a laser to be efficient. It would be a good starting tool as a good purge. So say, for example, if I were to just hit that center section, not to go outside of that line. So when you guys hear me say that, understand that I'm not saying laser stuff that is unlaserable. I'm saying if there was more density, if you were to purge out the center, meaning like hit it with a laser, allow it to shed, and forcibly move everything into the same cycle of growth, that would be my first move through it. If I didn't have that as an option, and she's right on the border, so like to me, it would be like, what is your goal going forward? And since finances are an issue, since like her schedule isn't an issue, I would probably go the thermolysis route here as a starting point. First clearance, probably within synchro, just based on the fact that she looks like she has a really good moisture gradient to her skin, with the exception of the cusp of her chin. Just that it looks supple in that space. They all look very vibrant. So my guess is that because if she was shaving frequently, she's got a lot of anagen growth in there. Was that what you experienced?
Yes. And so, she shaved twice a day. I don't think because of it growing so much from morning to night, but she was extremely self-conscious about it. So also you can tell that the shaving was causing a lot of irritation.
Yeah.
All of that redness around the hair follicles, lots of irritation, not too much issues with ingrowns, but definitely some ingrowns in there too. So,
and that hyperpigmentation and a little bit loss of volume right on the cusp of the chin there as well.
Yeah.
So this is, and when you guys ask me like, why do I do like a bunch of different modalities? Because I tend to do stuff based on like what's like the prime setup for me. Okay. So I would probably go in synchro to start it. Then I would go a short blend, okay, or a fast blend, however you want to say it, okay, as a following treatment. Probably no more than 20 units a lie, to be honest, because we've done our initial clearance. We know that we have younger hairs present. The skin seems to be in good health. I know that I can provide just enough, especially if you're working within like a 13.5 megahertz or a 27. The speed in which that lie is going to mature is going to happen faster. And so I would go probably like a 20 units a lie blend modality. I would not be pulsing it. It would probably be just like a synchro blend. If I'm talking applets, if I'm talking like silhouette tone machines, this would be short blend, soft blend in those spaces, or manual and setting it up in this way. And then on Apples, they say UL, sorry, not UL, EL. On silhouette tone, they say UE. It's the same thing. It's your energy intensity. So I would probably do a quick burst, especially if she is as hydrated as she looks, leading with galvanic and bursting the thermolysis on the back end of it. So not leading with high frequency. Usually if I'm leading with high frequency, I'm trying to pull some moisture to the area. But I would lead it that way. And then if I had any residual difficult hairs, I might do single needle galvanic on those like last few that just don't want to die. And that would be how I would attack this. Now, if she was lacking moisture, if she had contraindications, it would all be thermolysis, and it would probably be synchro first time and then like multiplex as my secondary. And then like a manual thermolysis towards the end if I was dealing with the struggle of those last residual pains.
So I ended up doing thermolysis here. I did do 2.5 hours in one sitting. This is not dense enough that it warrants feathering. Okay. So for those people that like don't, might be newer and don't quite understand like how much hair is too dense, for us to do in one clearing, this is perfectly okay to work through. Sure, the first cleanup is probably going to be the most irritating to her skin, but after that, it gets a lot better. So it's like Stephanie said, it's not large of an area. You can easily get this under control for the most part with thermolysis or electrolysis from the get-go. So there's no reason to not be able to do that. My goal when I do electrolysis is always to be able to clear the area and then maintain it. So always come back in and clear the whole area again. Because she is also very self-conscious with the growth, sometimes this is the type of client that might need multiple sessions per week, not so much because the growth is unmanageable or difficult to control in one appointment, but because any kind of speck of growth would be traumatic and then she might start messing with it. And that's definitely not what I don't want.
Yeah. I was just thinking, like, if she's shaving twice a day, she's probably going to see you, if not like weekly and like your first person on a Monday kind of thing. She's definitely going to be that person that usually is just like a Monday, Friday patient. So you have like 3 to 4 days in between. And then when you did her follow-up sessions, how long were her following sessions?
So first 3 months of treatment, which was kind of like that clearing stage, we did 2.5 hours on the first session.
Mm-hmm.
And then after that, we did 1 hour appointment every week for the duration of 3 months. So we don't ever need to do, it's not 2.5 hours every single week, especially if this is a client that shaves. When a client shaves, the bulk of the density is going to be present on the first appointment. So follow-ups will tend to be much shorter in duration. If it's a client that threads or waxes or tweezes, that may be a different story.
Yeah. That always gets me a little nervous when they come in with like a polling history, because we all know that like what we're about to see, and I tell them, you're never going to see your full potential unless you were to stop doing what you do for a few months on end and then start your electrolysis process, of which I don't need you to do that. But like, when you ask me, like, how much hair do I have? I don't know in that space. Where it's like, I know exactly, pretty much it's a consistent density pattern on this one. But I don't know if you can actually see my mouse when I do this. Can you see the mouse?
No, but I can probably give you some side controls. 1 second.
Okay. So,
right.
And I just, can you now see?
Well, that's just side controlling. Let me see if you can annotate. Do you want to try now?
Ooh, can you see me?
No.
Okay. So think of the lowest point of her chin being the least dense population in there. That, when I was talking about if I did any laser to that space, that is my stopping point. And then back in here, yep, right. So like about a 1/2 inch lower. So like right about there. Where that density starts to lighten, you stop your energy there. I also, when I say about doing laser in this space, an individual that has this kind of growth pattern, she has hyperpigmentation present. I would like test pulse her, see if I had shedding, see if that like her skin held up, and then go after it. I would not be like you come in and your very first time is that. So I want you guys to think, like, when I'm saying that kind of stuff, I'm not saying like, oh, go laser a woman's face, because I do know that, like, especially with hirsute cases, that's the quickest way to pH is to laser a face that shouldn't be lasered. And what I'm saying is like, we're just looking at that as like a force into anagen. I also know, because somebody's going to say it later on, that like anagen is not the only place we kill a hair. It's just a prime condition. Okay.
All right. So we did our first 3 months. At the bottom of these slides, every time we're kind of going through like a 3-month increment, I've put total treatment time and money spent per 3 months, and then we'll have a tally at the end. So you can see kind of how much how much time they spent, and how much money they spent, assuming our $100 an hour rate. So this was a photo taken 3 months into treatments. So we've been pretty consistent. So we can see the fine growth here. Probably these were like cut hairs, half treated hairs. It's very common to do that here. If you're causing a lot of ingrowns under the chin, watch your insertion. That's usually going to be the biggest culprit, is you're cutting the hairs and they're embedding. So lots of ingrowns down here is something to kind of go back and watch what you're doing. But growth is much lighter. So also, because she stopped shaving, and I like to point this out, we're starting to see some of these accelerated vellus hairs show up lower in the neck. And this is kind of what Stephanie was talking about. The reason why she would stop lasering at about this point here is because there's a good amount of these fine hairs. And this is the type of stuff that tends to be that paradoxical hypertrichosis that people get from laser. It's these little hairs that are the culprit. Also, I don't like my clients shaving because these are so light. They don't grow as fast as these bigger ones. And so at the time of appointments, if a client is shaving, let's say and stops 3 days before the session, I may be able to see some of these thicker ones, but these fine ones are not going to be visible enough for me to know that they're a problem and for me to remove them. So this photo before, you can see her neck and there's really nothing there because this was shaved. This is her concern area. But what happens is these accelerated vellus hairs, I tell clients, is like food for future terminal hairs. It's best to address it when it's an easy knockout at this point here.
Agreed. Absolutely agree. This episode is sponsored by Silhouette Tone, a global leader in electrolysis equipment and aesthetic technology. From advanced epilators to full spa solutions, Silhouette Tone empowers professionals to deliver safe and effective treatments with innovation at every step. Discover their electrolysis equipment and more at silhouettetone.us. And when I see those pop up, it's the start of seeing success down the road, but it's also telling me how bad it could be when you're shaving. As long as that's a blunted edge, I have no idea whether or not it's problematic or not, especially if you're texture based. Like some people are visual, but if you have somebody who's texture based when it comes to their hair problem, so it means that they're the ones that are always feeling it, right? And you have someone that's visual, they're always seeing it. They're not going to see these hairs, especially underneath the chin. And so that means that I can take away that texture of the blunted edge and you get to feel smoother sooner. So I know how hard it is not to shave in between sessions. And I won't ever fault a client for doing it, but I will definitely say that when it does happen, it does make our job harder.
Agreed. So here is 6 months into treatment. And so we're looking at control phase. So phase 3 to 6. So at the beginning of the 3-month, and this is at the end of the 3-month. And so we can see that there's a good amount of reduction. I've also been chipping away. So there's some scabbing down here. And so you can see like the little bitty scabs. I've been chipping away at some of the finer hairs every session that she comes in. So at this point, we usually start to either reduce the length of the appointment or we start spacing out the appointment. So less frequent. So this client here was now coming every 2 weeks for 1 hour still. So we kept the appointment length the same, but coming weekly was not really necessary. Now, could I have found stuff to do every week? Yes. There's a lot of like small peach fuzz that I could have worked on, but that wasn't as much of a concern for her. So, yep.
I see all that peach fuzz on her chin and I'm so excited for her. I'm like, look at it.
So then we are 9 months into treatment. So this was now we started coming every 3 weeks, only for 30 minutes. So you can see between the hairs that are still dark is like clear skin, so we can count the individual hairs that are really left behind. So I did this appointment and then I didn't see her for 3 months and this happens, right? So this was a year in, but it had been 3 months since her last session. So she hadn't even touched it. So most of these is kind of what's left, right? They grow long. And so it's a concern, but it's very, very like a few here, except for this one. I don't know what was up with that. That one needed to die an extra painful death. It looks like there's an ingrown right here.
Yeah, I saw that. I was like,
Yep. I'm sure we attacked it.
Yeah. That one on the corner, that's where I hit it with like the 4-second galvanic and I'm just like, murder. Like it's, it's just me hitting it with like as much as they can tolerate.
So total treatment time, 21 hours and 15 minutes. And she spent 2,235. So that was case study number 1. So any questions about that, comments, concerns before we move on to the next?
Nobody.
Okay. So let's continue.
I got a question.
Sure.
Yep.
Sorry. Took me a minute to get to my mute button. Can you share your probe size?
Most likely when I started at this point here, I was probably using a size 3 or 4.
Okay.
And then most likely when I got to this point here, 3 to 2. It
Mhm.
depends. You know, if
Yeah.
if the majority are kind of thicker like this, I'd go with a 3. If they all look like this, I'd probably be at a size 2.
Yeah. And did you say synchro or did you? I can't remember what you said.
I most likely was doing mellow flash, actually.
Okay. Okay.
Yeah, when I said synchro, Eileen, it was me saying like that first.
Oh, you said synchro. Yeah. Okay.
And I would do mellow or multiplex as
Yeah. Yeah. I probably would have picked mellow.
Mm-hmm. I tend to gravitate towards that one more than any other ones.
Mm-hmm. Me too, actually.
Yeah.
That's
also my favorite of that one. It's like synchro's great to blast everything out, but like it's not going to help like down the road.
Right. So this case study here, so let's get to our next one, is a 28-year-old cis female, no known health issue. Now, and this is where we can kind of debate. Would you consider this a hirsutism 1 or 2?
Honestly, I'd probably consider this a 2. Because 1, I consider incidental hairs, and this is getting to a point where she can't hide it.
Yeah, usually when I say like the two sides of the island connect, that's usually when I'll go to a 2 at this point. So but it's so small in the middle that I'm like, I was very borderline. But I did hirsutism 2. Currently shaving the area. She tried laser but was unsuccessful. As you can tell, the hair is kind of reddish brown, you know, so it's not dark enough. We scheduled 1 hour to completely clear the area for the first time. So
this is also like, other than her red hair, this is less density than the last one.
Oh yeah.
One, as a technician, even if she had brown hair here, I wouldn't do laser. Like, you have so much gap space. There's no target. So.
Oh, I mean, it's like an hour to clear it. It was, and you'll see how quickly this case really went. It's a waste of money to do laser, knowing that you'll have to finish with electrolysis anyway.
Yeah.
So this was pretty much, most likely I was using like a size 3, and I was doing mellow, which tends to be kind of where I'm at most of the time. And so this was, this picture here, I think was 6 months in. So it had been a couple of weeks since she came in. And so that's kind of what she had left at this point. So the first appointment took us an hour, and then subsequent appointment for 3 months were 30 minutes each. So 6.5 hours for $130. We did control for the next 6 months. So that's kind of where like that whack-a-mole is, the hairs that are coming in. It's still frequent appointments. And so we're still kind of going through trying to knock the majority of these out. And so she was coming every 2 weeks for month 3 to 6, 30 minutes in length. And then we did every 3 weeks for 15 minutes only, month 6 through 9. So every time we were going down, we're reducing and stretching out the appointments. This was a year and 4 months in. And so, yeah, I had done a little bit of work, but it was mainly like peach fuzz. Like I was kind of working on these things here. She actually had no more dark hairs. So she was done. She was doing maintenance for like month 9 to month 12. So once a month, 15 minutes. And I was kind of mainly going for like these little fine ones here that you can see that are just kind of slightly darker, you know, just to say that we were doing something. I haven't seen her in a long time. So
were you playing in Pico Flash by now?
I don't tend to do Pico Flash a lot. No, I was probably still doing mellow. It depends. Unless the client's like extra sensitive, then I might go to Pico. It's not a bad choice.
Yeah, I just was curious if you made the shift to it.
Good.
Just so everybody knows, I actually finally just brushed it away. Every one of the case study pictures so far had the exact same hair on the face. And I realized it was my hair on the screen.
How did you miss this? So this case took 12 hours and 45 minutes, and she spent $1,150. So
total 12 hours.
Yeah.
45.
Yeah. Over that year and 4 months or so. So it's not bad at all.
Wow.
So there it is again. Now this case I like. So 60-year-old trans female, history of daily shaving, not a laser candidate, wonder why. Client sensitivity, availability, budget, and health were not an issue. So she could pretty much come in whenever we said for however long, then work anywhere. She never twitched. Total clearance in a single appointment is neither feasible nor recommended. So we budgeted 2-hour appointments twice a week. So let's talk about kind of how you approach a big case like this. Sometimes I feel like people get like overwhelmed, seeing like, where do I start? It's going to take forever.
Okay, so how I would go about this is going from exterior to interior, okay, of the face, and then either cheek down or neck up, depending on if they're presenting femme in their day-to-day. So if I'm going neck up, usually it's so they can keep a weird, thinned out beard growth while they're still presenting mask before going full-time on their social transition. I still thin out those areas. So when I feather in, I usually go about 100% to 75% clearance back towards the sideburns every time they come in, 75 to 50% towards mid cheek, 50% to 25% of the area towards forward cheek, chin, corner of half of lip. Then if I'm doing 2 hours and I'm like you, if I can get them there twice in 1 week, I'm going to do upper face, lower face. And what I'll have them do, because most likely she's still shaving, right? Is I will have her have a delayed shave on one area, just so that, like, as a starting point, so that she's not having to have everything grown out. And so she can still like have a little bit of a relief of the dysphoria. But that is only if that's a struggle, right? Otherwise, grow everything out. I'm going to go half upper day 1 and half lower day 2. And still the same patterns. As I get towards that center, I really keep those first couple clearances to like 25 to 50%, depending on how dense. Her hair is not actually as dense as I thought it was going to be on the sides, because like that underside is really got a lot of population of hair, but like the corners of her mouth and down into her chin, like the marionette area, she looks like she could handle on the corners closer to 50%, but on her lower lip and upper lip, that is a very dense and high lip line. I'd probably go more like 25% when she's coming in. But also, I would have her put on numbing cream on the first half of the face before coming in, and bring her numbing cream with her. And then when she gets to the office, I'd have her apply the numbing cream on the other half. And usually when I say numbing cream, it's not the whole part of her face. It would be like upper lip, lower lip area. And so I go a little bit more strategic. So in that first hour, it's like 15, 15, 15, 15. Okay. So as you're working those zones, it gives a patient like a timeline that they know that you're going to be in that space. And it helps you kind of like strategize how much time you're spending in that zone. And then I go to the other side. And then same thing on that second day.
Definitely a good case to handle with synchro or whatever modality that has the longer timing. Mm-hmm. The goatee area is the most dense, and you can tell as you're getting down towards the neck here just how much less dense it is, right? You can see skin around the hair, and then as you go up, that becomes less probable. So then like 2 hairs together, right? So we'll come back to this slide. I just kind of want to show a couple more photos here. So this was a before, here's the front, right? So you can see the density there on the chin. This was, I believe, 9 months in. And here's the side. Cheeks did not have much density. And so you can see here, I was able to clear most of this here, like from here up in one go. So we were able to be 100% because you could see how light it is. But as we're getting down here, so below jawline and this corner here, we had to be careful. This is also the area that tends to be the easiest to scar up, just the side right here and the side of the chin here. So this is where you really have to be careful.
That first photo was deceiving because it looked thinner on the sides and thicker. Yep. And when she showed it this way, it's flipped.
Yeah, for sure. I like this photo too because it gives you a good idea of what we're talking about when we're talking about orange peel skin. And so if you look at the photo 9 months in at the bottom and you have kind of like that bumpy texture around the mouth, upper lip and chin, that's kind of what we're talking about. I mean, you can kind of, Stephanie, you explain it well sometimes too. If you look at the cheeks, you don't have that issue because the density was just not the same at all, So those areas, you'll definitely see a little bit of structural difference in the skin. It evens out, but it takes about 18 months or so.
Did she have any like filler or facelift in that second photo? Because her marionette and her nasolabial folds are less.
No, most likely the angle. It was more sideways on the top one, and I think it's a little bit more angled on the second one. And so most likely we just kind of, the lighting was different.
The one of and for anybody that's new in electrology, when you guys are watching this, hair is volume, right? So when I talk about volume, density, color, right, there is volume. And if you were to take all those hairs out and fill up a cup, it would fill the cup, right? And so you have to think about that strategy of reducing that volume in stages. That back part of the cheek neck area where you were talking about you clearing out 100%, absolutely. Her skin's very resilient back there. It has better health back there. She has less of that droop already from like aging, right? And so we can go a little bit more assertive or aggressive in that space. Towards that front half where she has that already having that laxity, especially in those nasolabial folds, your stretching is going to be much more difficult in this space. You're really going to have your patient kind of age you so that you can have that flattening of your work surface in your stretch, so that you're not having too much heat on the upper portion of the hair or the hair follicle, because you're going to real quickly overwork that tissue, and that volume that you're taking out, especially in her advanced age, is going to look like wrinkles, and it will look like you've aged her for a short period of time until her collagen and elastin can catch up in that natural healing process. And she probably will need some rejuvenating treatments to give her that softness that she's hoping to have, because you just took out the volume of hair that she's had for probably since her teens.
And and I like to point out in this photo, if you look at the before photo and you look at the front of the chin, there's texture there already.
Yeah.
Right. And so this is another reason why taking these before pictures is so important, because you can see pores, you can see a little bit of pigmentation, and you can see texture on the skin. It's not soft to begin with. Mm-hmm. So keep that in mind when you're taking, taking clients, having some nice clear photos that shows the skin. This is not one of our, a super young patient. So there's going to be some signs of aging on the skin to begin with. But a lot of so like this area here is the same one here, and there was texture before, there's still texture there, but for the most part this is looking pretty smooth, and then with time a lot of this will soften up a little bit.
When you are looking at that lip area, okay, so when somebody has substantial facial hair and they've had it for a long time, you have a natural curve to your lip because that volume pushes the lip out.
See it here, like she's kind of tucking her lips in, but you see how it's like more bumpy?
Mm-hmm. So as that hair goes away, you get a natural lip flip. So your lip, like if you guys know The Simpsons, like Marge Simpson always has like a forward portion. And when you remove that volume, it flips upwards. But in that same token, like, so if she were to have facial feminization and they did a cut lip flip, they take 4 millimeters of skin from here and pinch upwards, and that flips it up more, and it gives more of that, because
no, I think she froze. Well, as she's getting unfrozen, let's talk a little bit through oh, there you go, you're back. You were frozen for a little bit, so
sorry. So most individuals assigned female at birth will have that natural flip because of the lack of volume of hair in that area. And then they'll also have a little bit more teeth showing. So you might have a procedure to lip flip it with a surgeon as well.
So let's talk through a little bit of how her treatment plan ended up working out. So clearing the first 3 months. So we weren't able, obviously, in one sitting to clear from cheekbones to collarbone because the density was too high. We budgeted 4 hours a week of electrolysis, and it took us about 48 hours. I can say that by the end of the 3 months, we had gone through everything. So we had cleared from cheekbones to collarbone, but it took us about 48 hours to do so. When she entered the control is once I've cleared the area all the way through, both what's visible and what has yet to grow in, which is why it takes 3 months. Then we are now doing the whack-a-mole. I'm getting hairs that I've assumed that I've treated before that just haven't gotten the hint just yet. And then we keep going this way. Now, because we're maintaining, meaning that every week, my goal was to clear her from cheekbone to collarbone. So at the end of the week, she could go, and then next week we were going to address the regrowth. So we had to keep the appointments the same length because it took that much time to get through it. In the beginning, in those 4 hours, we might only get down to the jawline. But at this control phase, we're going cheekbone to collarbone. Every week took 4 hours, but we would clear it. So time spent ended up staying the same. When we started getting at about that 6 month mark, which is to 9, and then 9 months is when I have those photos, we started reducing the amount of time that it took for us to be able to clear it. So it didn't take as long for me to do cheekbone to collarbone. So we're looking at 2.5 to 3 hours. So 36 hours total. At month 9 to 1 year, it took us 2 hours once a week to be able to clear the regrowth. So we're looking at about 30 hours. This is where we're at this point. And this is here at month 9. Look at the underneath photos. The skin, to me, looks pretty good considering the amount of hair that was removed, and it only will improve from here. So it took about 181.5 hours for this case, and she's spent about $18,150. So when you're comparing this type of thing to the cis female, the cases that we've had before, it's definitely a different type of commitment. Doing a full beard, on average, the numbers that I've given insurance companies and doctors will take anywhere from about 150 to 300 hours sometimes. She's not the most dense case that I've seen. I've seen lighter also, but this is about midway through the range of what you might be expecting. What do you think?
Yeah, absolutely. That's right on par. They end up spending a lot more money when we're rushing ourselves through the process because they end up with more retreatment. So I've seen this number be exponentially higher. Right now in the insurance world, at least here in Washington, we have, I want to say for genital clearing, we get 156 units per year with the state insurance.
156? That's it? Per year?
Per year. So for just the genital, for surgical prep. So 156, so let's say 70, 80 some odd unit or 80 some odd hours in that year. So you can get quite a bit done in that time frame, and that's not bad, right? But for face, I have to ask for prior auths usually about every 4 months, because of this timing. Units are a 30-minute segment. So 156 divided by 2 is how many hours of genital. For the face, we're asking for a lot more. And we kind of luck out in our state. This is not just for gender affirming care. This is my PCOS patients as well. But here's the big deal. My PCOS patients and my gender affirming care patients are both able to access through insurance. But if you look at her case studies, so that first case study to this third one, okay, you have to hit a deductible with most insurance plans. Okay. And so that out-of-pocket expense for the patient might not equal what their deductible is. Where in her case, she'll not only meet her deductible, right? She'll then so she'll probably hit that deductible and then still have all that extra time to go after it. And this is not even a dense facial hair pattern. If I had somebody that we have 2 cases right now, they, the 3-month approval for face was 4 month approval. So 16 weeks was 96 units. it's just, I mean, every hair follicle is filled with a
Mhm.
term. And so we'll probably run out of those units because of just the sheer volume of hair that this patient has. But and we'll have to ask. So if I'm asking every 16 weeks, usually by I would say by week 12 is when I'm doing my assessments for my next batch of requested time frame. So you really have to be on top of the stair-step method in this space.
Want to keep learning on your own time? The Electrology Education Coalition offers a growing library of home study courses covering advanced techniques, ethics, business planning, and more. Earn CEUs, stay sharp, and continue building your skills. Explore the catalog at electrologycoalition.com.
So the question was, are different insurance codes for PCOS? There's a different diagnosis code. Usually the electrolysis or the treatment code would remain the same. So a diagnosis, yeah, go ahead. Yeah, go ahead and add the codes in there. So the CPT code 17380 tends to be the code for 30 minutes of electrolysis. And that would be across the board. So but the diagnosis of PCOS is going to be different. For transgender individuals, it's usually F64.0 or F64.9. PCOS is what, E something?
Like L67, sorry, E282. Sorry. I was looking at a different one. So we have hirsutism in general is L68.0. I'm going to be putting these. Oh, good. It finally, it was taking forever to populate over here. And then it told me that I had too many characters. So now we're going code by code. So you guys are going to see me drop these in here. But this first one, like you could literally have someone diagnosed for just hirsutism. So like just somebody that has substantial growth. This next one would be like folliculitis. And then additionally in that you can have the, which is L66.2, but you can have follicular disorder unspecified. This is going to be 2 of them. So like sometimes you might know that it's folliculitis, but you might not really know what's going on. And this might be another one that comes into you. PCOS, the ICD-10 for that is E282. And I'm going to be putting that in the chat now. I highly recommend that you guys copy and paste this while you're kind of chilling here. Then there's also hair disorders. So like, I have to think of it like KP. There's a hyperhidrosis supervilia, I think is how you say it. Where
go through all of these, by the way, in the one home study you did.
Yeah.
With the insurance intake. So a lot of those, there's all the slides are in there. So we're kind of giving you a little taster here. But I do encourage, if this is something that you're doing to go and actually do, there's the bundle for that, by the way, which includes kind of like the how-to and how, setting up with insurance companies. And then Stephanie goes through the, all of the intakes that you really should have in place and all of that.
Yeah. And I'm an in-network provider, not an out-of-network provider. So I'm contracted with insurance companies. I will not tell you my contracted rate. It's not going to be the same as you guys, and you have to negotiate your own. But some contracted rates are going to be standard, like your state insurance is going to be the same for everybody. But like sometimes you can bill for things that you are doing within that space. And that's why that bundle is like, that was our January lecture, kicking off E2C this year. And because the 2 of us both do insurance cases, but she's an out-of-network and I'm in-network, it kind of plays differently. And there's going to be some rules that you have to follow within your state of what is approved and what isn't. If your state doesn't approve gender-affirming care, the chances are it won't approve PCOS either.
Yeah. Okay, let's see where we're at. So here's another case that I had. So this one's maybe a little bit harder to see. She, I kind of have it more summed up in one slide. So this was the before. She was one that used to tweeze and liked to dig out the hairs as much as possible. So you can actually see the damage and the pigmentation and the ingrowns, a lot of redness, right? So she would have these inflamed follicles here. So there was no electrolysis done in that first photo at all. So what you're seeing really is just kind of from the hairs themselves.
Yeah.
This last photo here was taken at the beginning of month 11 appointment. So it had been pretty much a year here. So this is kind of what was left. I had not treated her yet. So this is a true reflection of what was left as far as the hairs go. So month 0 through 4, we did weekly appointments, 30 minutes in length. So 17 different appointments, 8.5 hours. Month 5 through 11, we did every other week, 30 minutes. And so 8.5 hours. And then at the end, so pretty much when we got here, she would come in for some of these little fine ones here that you see down at the bottom. That would be, and then like a random one right there, right? That just hasn't gotten the hint. That's usually what I consider maintenance at this point. So just monthly appointments and 30 minutes each, because I would get fine stuff, 2 hours, $240. So 19 hours in total. I used to sell packages, like groups of hours. And so that would have been like my 20-hour package, right? And then she spent 1,260 in my imaginary rates.
You like doing packages?
I don't do packages anymore because everybody in my office is a slightly different rate. So but I do gift cards.
Okay. Yeah. I'd rather a prepaid gift card than a package any day. People just don't, in my experience, I haven't had good luck with it.
Mm-hmm. All right. So that was this one here. And this is kind of a different type of case. So this is a transgender man surgical preparation flap of skin. So this was on a thigh, and I mapped out the area, took photos of it just so that you can kind of see what 25 by 25 centimeter square skin actually looks like. It's quite large. So they will always have you clear much more than they will end up using. It's because they want the freedom to choose where they want to. For the most part, the urethra tends to be the outside lower part of the leg here. Sometimes they'll take from the inside. It just kind of depends on where the blood flow irrigates best. But client had been on testosterone since they were 18, and this patient is 39 years old. So we've talking about a good 20 years of testosterone. So, fairly good amount of dense hair growth. The hairs just aren't very, very thick.
I love when my patients have been on hormones for, especially testosterone, because it builds in the system just like it does during puberty. Because when did you start the process for them? Because was it at the 39-year mark, or was it?
No, it was maybe like 37.
Okay, so still a long time. Basically, I mean, if you've been on testosterone for more than 5 years, the hairs that are there are the hairs that are there. Like, it's not going to really change.
So, the initial clearance of that whole entire square took 8.5 hours. And I say 8.5 hours because this is not just clearing the thick hairs. It's clearing all of the fine hairs. We're clearing everything. We would do 3-hour appointments twice a month. So not as frequent as far as when they came in, but the appointment lengths were 3 hours. So month 0 to 3, that was an 18-hour commitment. Month 3 to 6, reduced to 2 hours twice a month. Didn't need as much time, less regrowth, right? 12-hour commitment. Then we were an hour and a half twice a month. Then we were 1 hour twice a month. And then we came to 1 hour once a month. So that's kind of how this ended up looking for this client. It was 48 hours total. Then they went for surgery, $4,800. That is not a correct number.
Not like, wait, how?
Like, it's not mathing, but it is mathing because that's 2000. And yeah, that's good. Okay. So that's kind of what we're looking at here.
Wow.
All right. And I think that's all I have for these case studies. So I'm going to stop the share here. And then if anybody has questions, comments, we've got another 12 minutes. So now's the time.
I'll forever hold your peace.
Now, how many people have some case study stuff or have, accumulated some of these types of data, or is starting to? How about that? Who's like taking photos? Who's the electrologists in here that are documenting what they should be documenting?
I will tell you that if you are doing insurance-based care, even if you are not in network, you need to chart the heck out of what you are doing. You need to document what you're doing. The reason I say this is you don't get paid in the insurance world unless they see that you've done the work. And insurance companies, they're going to want your levels. They're going to want that kind of stuff as well. In many cases, they don't care what the levels are. That doesn't mean anything to them. That's like a doctor prescribing medication. They want to make sure that it makes sense to what other people are doing. But outside of that, they just want to make sure that you're doing the work. So if you're not charting and a minimum, that's a problem. But I would recommend, especially as a newer electrologist, that you get into photo documentation. Other than the fact that how do you say that you do good work unless you show you do good work and you don't have the track record yet? But also the patients are going to ask. So if you can show them what you talked about in that consult is what is happening in front of them and you're getting to see those results, it helps you.
Mm-hmm. Sue said that she's going to start tomorrow.
Oh, good. Thank you, Sue. I appreciate that.
Michaela said she's got some before and after photos, but she hasn't kept track of time and cost to probably go back into their files though. Yeah, I mean, it's good because the truth is you want some sort of estimate to tell clients when you see a case come in, because do you know how long it takes you to clear chin hairs? Do you know how long it takes you to clear, a surgical area and things like that? So you'll want to have some ballpark numbers. Obviously, we always say that you never give people exact time frames, right? Because it varies quite a bit. I mean, we just saw four examples of 4 different chins, and they all varied pretty wildly, right? So there was quite a bit of difference in the amount of commitment, the amount of money spent, and all of that.
Michaela, if you're not using a medical program to chart, honestly, as long as you have the upgraded Google account or there's a HIPAA compliant one to make it so that you can do that, everything can be in Drive. I want to say that it's about $5 a month on that one for a couple terabytes worth of material. I really recommend when you do upload it that you do it by last name, first initial, and date of. So that photo would be last name, first initial, date of service. Then you can search it easier.
Yeah.
Okay, thank you.
Yeah, absolutely. And I don't know if you guys have ever used it, but Dropbox, I think I paid, and I have a very large Dropbox account, just so everybody knows, because I have years of educational material in there that just keeps going. I pay $20 a month for my Dropbox. And I can back up my stuff there. That if I wasn't using Drive, and I was just using my computer, it kind of every night it goes right into there, and the way I save it uploads to what I need. And so that's kind of a cool thing. I don't have to do extra thinking. Because extra thinking makes my head hurt in those moments.
And I've kept a lot of the data. I've upgraded Vagaro with a lot of different things. I've done the Drive so that I was able to upload photos on there. There's ways that you can put notes. You can do soap notes even. So if you wanted to upload and create your own soap note, you could technically. And I did this. The first case study I did that I showed you guys, every single visit was a soap note and a photo, because I went in with the intention to make this a case study. So I overdid the data. And when we do the research project, that's going to be the type of commitment that I'm going to want. It's going to be overkill, but it has to be. Obviously on your day-to-day stuff, that's unnecessary, but it can be done, and you don't really have to have a big medical type of software in order to keep that kind of stuff.
Yeah, not at all. The only reason I use the medical software I use is because that's what my medical director uses. Yeah. Otherwise, you can't do it in companies like Fresha, but Vagaro and I can't think of Square.
Well, Vagaro is HIPAA compliant too.
Yeah, and you really need to make sure that you are protecting that information. So,
yep.
How we doing? Oh, it's the final countdown.
That's right. So let's maybe talk about some housekeeping stuff.
Mhm.
To finish up what we've got going on, maybe just to kind of let you guys know what's coming up pretty soon. So this month on Sunday, let me pull up the calendar, Sunday the 22nd at 9 a.m. Pacific Standard Time. That means that it is noon in the East Coast. We are going to be doing the PCOS and the electrologist talk. So Stephanie's going to be speaking from 9 to 11. It's 2 hours. It is pre-approved. The AEA did change how things are going to be submitted. So I'm actually going to be trying to rework that stuff. By the way, if you are an AEA member, CPE, non-member, doesn't really matter. If you're a CPE and you are looking to get your continuing education credits added to your transcript, please know that you have a deadline to do so following when you actually take the course. So if it's a live event, you've got 3 months. If you do a home study, from whenever you take the home study, you've got 3 months. So you have to submit your stuff in the timely manner. What's good is that it's going to be done over their website. What's not good is that it's sometimes, I think it's a little hard to find. So I'm going to try to make a how-to video that I'll put inside the courses so that you kind of have an idea as to how you can submit your stuff for that. If you're just printing out your certificates to put on your wall, then ignore everything I just said.
In October, Joanie and I will be at the American Electrology Association meeting in San Diego. During that, we both have distribution companies, so we'll have our distribution up in the vendor room, and then we are trying to come up with a meet and greet, get to know you guys in person if you guys are going for the event. We haven't really solidified anything, but we've had a few people ask about it, and we definitely want to make sure that we'd love to see you guys too. That's fun for us. So we'll definitely let you guys know when that happens as well. And then you have November.
Yes. So then after that, it's looking like November 17th. I'm doing the skin healing webinar. So that's also a Sunday. It's always at the same time, right? So it's a Sunday. It's at 9 a.m. our time. And I think most of you know, but I'll reiterate again, anytime we do a live event, it is converted into a home study, usually about a month after the live event. So if you are not able to physically be at the live event, panic not. Just buy the home study. So don't go buy the live event if you're not going to be there, because I will be just shifting you into the home study. So either way, you're not going to have access to it, the recording or anything. It's going to have to be the home study portion of it. But anytime, it's not a big deal if you can't be there for the live one. It just means you're not going to be able to collaborate as much and ask questions and such. But the home study is always going to be available. And then Stephanie, I think that the last one is going to be you, and that's December 15th.
Yep. And that is laser and electrolysis strategies. So being able to understand how we can collaborate the two modalities to maximize patient efficacy, give them the results that they're asking for in a timeline that is beneficial to them and to us. So that'll be the last one of the year. And then we're starting to plan what 2025 looks like for mentorship hour, and like what we can do.
All the other things we're adding to our calendars. So,
chaos.
There is a calendar of events on E2C's website. So if you go on the website, there is a calendar and you can kind of see what we have planned. And so you can always kind of reference back there and see either where one of us is. So if it's, like me, I just did the Maryland Association meeting, and Stephanie's going to be in Illinois.
Oh, not in Illinois. Well, okay. So this weekend, Illinois had their speaker virtually. And so they contacted me and asked me if I could speak for 5 hours on Sunday. So I'm speaking for 5 hours on Sunday this week. You're welcome.
Do like an opera singer and don't talk for like at least 24 hours.
I'm like, yes. So that one is contraindications. We're talking laser and electrolysis strategy is going to be a shorter one on that one. And then oh my gosh, they just asked me for another one and I already forgot what it is. Hold on, I'm going to tell you guys in a second. So perfecting insertion technique. So the one in December, just so you guys know, is going to be a 2-hour one. This one is kind of a taster because they were trying to fill 5 hours of lectures. They just condensed something down. And then we have PCOS the next weekend. And then I have EAI. And wait, no. MAE. Sorry. Massachusetts Association of Electrolysis. Electrology?
Yes.
I don't remember.
Yeah.
Electrology. Electrology. Okay, got it. I'm
Yeah.
speaking with them, and that's charting insurance and trans healthcare. Yeah, sorry. And so we got some like bump. Then Joanie speaks at AEA convention.
Mm-hmm. Yeah, it's going to be positioning for transgender care. So
that's cool. We're kind of trying to come up with like what time to do mentorship hour next year, so that you guys can kind of, the East Coasters, we feel so bad for you guys, where that should be. And since we have a smaller amount of international members right now, we have to focus on in the States timing first. But we love you, Anita. So she's like,
yeah, most likely stay tuned. We're probably going to move this up a little bit. Like our regular time will be a little bit earlier than this time. So I know Eileen's going to be quite happy. Just to make it a little bit easier, a little more palatable. But
yeah. And that's it. That's like kind of what's coming up. We'll have more details for you probably next week because we have our 2025 planning meeting. So you guys will have more and more information as each month passes towards the end of the year.
All right. Beautiful. Well, it was nice seeing everybody. We'll see you next week.
Bye, everybody.
Bye-bye.
Bye.
Thank you for tuning in to this week's Mentorship Hour recap on Electrolysis Unplugged. If you found value in today's conversation, be sure to follow and share this podcast with colleagues who care about advancing our profession. For more resources, continuing education, and upcoming events, visit electrologycoalition.com. Until next time, let's keep building our field together through education, research, and community.